Hi everybody, this is Sharon Parlia. Again, this is Electronic Medical Record, Module 11, Steps to Implementing an EMR, Part 2. This will be our last module of this course, so I hope you enjoyed it. If you have any questions, feel free to contact me. You all have my email address, and let's get started. So once again, I want to just review the steps to implementing an EMR. As we stated in the last module, you need to assess your practice's readiness, very important. You need to plan your approach. Any project needs a plan. You need to select or upgrade to a certified EMR. Today we're going to discuss conducting training and implementing an EMR, achieving meaningful use, and lastly, continue quality improvement. So again, we're going to conduct training and implement an EMR. And with any project, you want to look at the processes, what do we want to do, and then we want to look at the outcomes, what did we want to achieve. So in this slide, we're going to look at the processes, the hardware and software installation. We hopefully purchased new hardware and software, the customization and configuration of the software. We want to test the systems and the interfaces. We need to train the leadership team, the providers, all staff. This is very involved. I'm going through this, high level right now, but all of these steps take time and energy and commitment, as well as collaboration amongst everyone. It's important to do a mock go live with testing of the backup plan. We sometimes call it a dress rehearsal, to test everything before the actual go live date. You want to be able to do chart abstraction and data migration. All those paper charts, you don't want to get all the information into the new EMR, but there's certain basic information you would like to have pulled in just so you have a basis, and your patients are what we call in the system. Whether it's just demographic data and insurance, maybe the last labs, maybe the last progress note. And we also, at this point, want to identify meaningful use criteria. What do we hope to achieve? And in order to achieve it, we need to identify, what the criteria is. So with any implementation or any project, we have processes that we hope to achieve, and then we have outcomes, that are hopefully measurable and that we were able to achieve. So when we, implement an EMR, we hope that we are able to achieve these outcomes. We want qualified and prepared leadership teams, providers, and staff. We want them, to be able to use the system. We want to go live. We want the EMR to be able to go live, and we want it, secured. We want it, safe. And in the short term, we want to improve objectives. We want to optimize the system. We want overall, a better system in place than what we had previously. The next few slides have to do with achieving meaningful use. I've been very involved personally in the hospitals I've worked at on working on the meaningful use committees and with stage 1 and now preparing for stage 2. So I am, pretty well versed in this topic. But for the purpose of this module, I'm just going to try to keep it high level and tell you basically what meaningful use is. So the Medicare and Medicaid EHR incentive program provides a financial incentive for achieving meaningful use, which is the use of a certified EMR EHR technology to achieve health and efficiency goals. That's how it is defined today. So what is meaningful use? What does it mean? Well, under the HITECH Act, and HITECH stands for Health Information Technology for Economic and Clinical Health Act, eligible healthcare professionals as well as hospitals can qualify for Medicare and Medicaid incentive payments when they adopt certified EHR technology and use it to achieve specified objectives. So they need to adopt it, implement it, and then achieve the objectives. However, it's not just enough to own a certified EMR. You can own a lot of things, but you must use the EMR in a way that can positively affect the care of the patients. Once again, it's always about patient care and improving patient care. To do this, providers must meet all the objectives, which I'll discuss soon, established by CMS for this program. Then and only then will they be able to demonstrate meaningful use of their EHR. They can attest to this, and then they receive an incentive payment. So as I mentioned, there are objectives that need to be accomplished in order to achieve meaningful use. They're broken up into core objectives and menu objectives. So I'm just going to highlight what they are. So for the core objectives, the first one is CPOE. So that's computerized provider order entry for medication orders, meaning that when a physician orders a medication, he does so on his computer, and it's electronic and it's documented. It's also, the second one is drug interaction checks. Usually most of the EMRs, it's done in the background, but there's a drug-to-drug interaction. Again, patient safety. You want to third one is to maintain a problem list. Very important, it's an ongoing list that's, in the EMR. Next, the physicians need to be able to e-prescribe. Not saying that they e-prescribe 100% of the time. Many narcotics, for instance, cannot be e-prescribed, although they're moving towards that in the future. But it's safer for everyone if the doctor can prescribe, and that prescription goes right to the pharmacy without any handling of the paper and the prescription by the patient. Next, need to maintain an active medication list. You need to see, be able to look at and see what medications the patient is on at any given time. Also, a medication allergy list. What is the patient allergic to? Are there, is the patient allergic to penicillin? Then you can't prescribe penicillin. There's checks in the background that, usually take place. We need to be able to record demographics. Again, we need to record vital signs. Smoking status, this became a very important issue, tobacco use. Clinical quality measures, clinical decision support rules, what is, what are the decisions based on, when a physician makes certain decisions. You need to be able to provide patients with an electronic copy of their health information. Whether it's on a thumb drive, a CD, whatever it is, a patient is entitled to receive a copy of their medical record. You also need to have clinical summaries. Next, you need to be able to perform an electronic exchange of clinical information. You need to be able to, they have health information exchanges, which I've mentioned in a previous module, and you need to be able to exchange information, clinical information, with one of these clearinghouses or with just sharing information, in other ways. And you need to protect the electronic health information. Next, I want to talk about the menu objectives. Again, these are reportable objectives that need to be reported to CMS in order to achieve meaningful use. The first one is drug formulary checks. The next one is clinical lab test results, or results coming back into the medical record. A patient list, patient reminders, such as health maintenance reminders. Is the patient due for a mammogram, or a yearly checkup, or a flu vaccine? Patient electronic access. Patient-specific education resources. Often, when the patient leaves your office, you need to be able to, educate them on what you just discussed, or what's wrong with them. Medication reconciliation, very important. Transition of care, what's going to happen, next. Immunization registry data submission. We need to be able to submit data, these data holding banks of immunizations, and also syndromic surveillance data submission. These are all fields that need to be collected, and often or easily collected once you have an EMR. What the goals are of meaningful use. The overall goals of meaningful use are to use the technology to do the following. You want to improve quality, safety, and efficiency of patient care. You want to be able to engage patients and family members. You want to improve care coordination. You want to ensure adequate privacy and security for personal health information. HIPAA rules, you want to make sure they're in place. And you want to improve population and public health as a whole. Continue quality improvement. This final step of implementing an EMR refers to reassessing what you've learned from training and everyday use of the system. It emphasizes continuous evaluation of the practice's goals and needs post-EMR implementation to continue improving workflows that achieve the individual practice's goals and needs while leveraging the functionality of electronic health records. We often refer to this as optimization. We want to improve what we're doing today and use all the functionality that the system has. And lastly, I want to talk about post-implementation. Again, there's questions we need to ask ourselves. Was it successful? Were the goals and needs met? Do workflow processes need to be reevaluated? Do we need additional training? Just because we implemented the EMR doesn't mean, there's other things we may need to do. Are we capturing the required data elements needed for clinical priorities, as well as, are they reportable for quality measures? Are we capturing the information we need to capture? Do staff roles and responsibilities need adjustments? Sometimes when we implement an EMR, we need to change the responsibilities of our staff. Not necessarily eliminate staff, just, reassign duties. Is the technology in the appropriate location? It may have seemed like a great place to put that, laptop or that, machine on the wall, but maybe it's not. Maybe we need to move it now. Is the technology reliable? Is it fast enough? Maybe we need additional hardware. These are questions, there's always going to be questions that we need to ask ourselves. You always want to keep the system fresh. You always want to make the system better, but you want to have it in a place where it's usable and attainable to achieve, the goals you set out to achieve. Once again, I want to thank you all for completing, this course with me. This is the end of Module 11. It's also the end of the course. Thank you very much, all of you, for joining me. I appreciate your time, and I look forward to meeting with you again. Thank you.